Hi, I'm Justin Riley. Today on Wisconsin Doctors, we'll be on location at Bluff Medical Center to learn more about medical imaging technology. My guests will include Chelsea Cook, Director of Medical Imaging, Dr. Frank Thornton, Vice Chair of Community Radiology for UW Health, Kelly Honold, Lead CT and Mammography Tech, and Dr. Liz Teigen, Medical Director of Medical Imaging at Bluff Medical Center. That's all coming up on Wisconsin Doctors on CW57. Stay right here. Hi, welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center here in Mauston, and today we have a really interesting topic for you. We're going to be talking about advancements in medical imaging technology, a really great topic, and I'm joined now by my first guest, Chelsea Cook, who is the Director of Medical Imaging here at Bluff. Chelsea, welcome.
Hi, Justin. Thank you.
Yeah, it's so good to have you with us today. So medical imaging is something that's come a long way, obviously, since the introduction of X-ray technology. Can you talk to us a little bit about some imaging services that are now available here at Bluff?
Sure, I would love to.
Yeah.
Bluff is a happening place. We offer state-of-the-art technology. We offer services using state-of-the-art technology.
Sure.
Our general diagnostic area utilizes all digital technology to perform routine X-rays of the spine, abdomen, chest, pelvis, and extremities. We also provide common tests such as CT, MRI, ultrasound, mammography, fluoro, bone densitometry, and nuclear medicine.
Very cool. So a variety of different things.
Yes.
Can you elaborate on what fluoro is?
Fluoro is real-time imaging.
Okay.
So using a camera, so to say, like a video camera,
Sure.
to take images of different organs.
Oh, sure. Okay. Great. Interesting. Very cool.
We also offer PET CT every other Saturday, which is a test used to often detect cancer.
Okay.
And then to top it off, we provide interventional radiology here at Bluff, which, you know, irregardless of whatever kind of X-ray we're providing here, all of our images are stored on our PACS system and interpreted by one of our radiologists who we have a great partnership with.
Yes, and we'll talk to some of those later on
Yes.
today. Go ahead.
Chelsea, if I might interrupt, the PACS system, I think that's something that our viewers may not be familiar with. Could you explain a little bit to the viewers how the PACS system
Yes.
helps our workflow?
Great question.
PACS is an abbreviation for Picture Archiving and Communication System. It's a network of computers that replaces film with electronically stored digital images. It provides archives of multimodality images, no matter what kind of exam or type of procedure it is. And PACS is integrated with images as well as the patient database information, and then that displays both the images as well as the patient information, and is available on any of the workstations throughout Bluff Medical Center.
Yeah.
So any of the providers within Bluff can review an image at any time and obtain results.
Sure.
There's no doubt it's a huge game changer in patient health care. It really is.
To have that access from multiple different providers.
Right.
Absolutely.
Right.
To do that.
And the providers even have the ability to review the images at the same time from different locations.
Oh, that's very cool. Very cool. Awesome.
Yeah.
Chelsea, can you talk a little bit about the newest imaging technology here at Bluff?
We continuously look to the needs of our patients, and interventional radiology was one of those needs. We felt that it is an important step in providing the cutting-edge care for our patients of the community here in Mauston and the surrounding areas. Interventional radiology requires a specialized radiologist who uses CT, fluoro, and ultrasound to guide passage through the skin by needle. Puncture, including introduction of wires, catheters, for performing procedures such as biopsies.
And that's all part of like things that are done by the medical imaging team then.
Right.
That's really
the
interesting.
interventional radiologist.
Yeah.
Chelsea, I might add that we have a whole host of interventional procedures. We have very specialized procedures that our subsection of interventional radiologists perform, but there are many interventional procedures that diagnostic radiologists such as Frank and I also perform. So just because we're placing a needle or doing a procedure doesn't mean we have to have that specialized interventional radiologist. We do many procedures. Frank was here yesterday doing some interventional procedures. I was here on Monday, also had an interventional procedure. But what we've done is find that we want to offer some more advanced interventional procedures so that the patient can receive that right here at home, as opposed to traveling to the big city to get that done. But Chelsea, maybe you can also tell us, how do we stay up to date with advancements in medical imaging?
And we just have a few seconds left, so I mean, go ahead though, go ahead.
Okay. Well, part of progress is change, and our ever-growing capabilities of our state-of-the-art department are a great example of that, and that's why we make it a top priority to stay up to date. Changes are constantly occurring nationally, requiring new strategies and approaches for any organization to be successful. And our administration here at Bluff supports and values leadership growth. Dr. Tigan and I are actually going to a seminar in a few weeks in Boston, radiology leadership seminar, and I'm looking forward to that, taking that information that I obtained there and bringing that back here to Bluff, to the community and to our patients.
Always learning something new to bring to the patients. That's
Right.
important. Chelsea Cook, Director of Medical Imaging, thank you so much for the information today.
Thanks.
Don't go away. When we come back to Wisconsin Doctors, we'll be talking with Dr. Frank Thornton. It's Wisconsin Doctors on CW57. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center in Boston, and today we're talking about advancements in medical imaging technology. And I'm joined now by Dr. Frank Thornton, who is the Vice Chair of Community Radiology for UW Health. Dr. Thornton, welcome.
Justin, it's great to be here.
Yeah, so good to have you with us today. Can you briefly explain to our viewers what role radiologists play in patient care?
Absolutely. I think the role of the radiologist is probably not very widely understood. A radiologist is a physician, and they specialize in diagnosing disease and injury by using multiple medical imaging modalities. And Chelsea has just done a great job outlining the broad range of modalities that we have available to us here on site in Bluff Medical Center. The majority of radiology is diagnosis, using images, CT or MRI, to detect disease and injury. And we call this diagnostic radiology. And we've also talked briefly about interventional radiology, and this is different because it uses imaging-guided, minimally invasive techniques to do things like draining abscess cavities, taking biopsies when needed, injecting joints, spines, even treating cancer. And it's important, I think, for viewers to know that when the radiologist has reviewed their exam and dictated a report, that the ordering provider, and more often nowadays the patient themselves, can access this report in the patient's electronic medical record. Now, one point I'd make is that for complex cases, we much prefer the radiologist and the provider to get together, either over the phone or face-to-face, to discuss the case. It's just much, much better for patient care, and a lot of what we say is really dependent on the information that we get from the ordering provider. And this happens several times every day when I'm here on site in Bluff Medical Center. The information we get from these interactions, it allows these critical clinical decisions to be made. You know, does the patient need to go on and see an orthopedic surgeon? Do they need to have a biopsy done? Do they need to go to a larger medical center for treatment? Or does the patient need to change their lifestyle based on, you know, incidental findings of coronary artery disease or early emphysema? And because of all these things, I think the radiologist has truly earned the reputation, the doctor's doctor.
And being able to confer then with the primary provider, you know, putting two heads together is always a benefit then to the patient.
It's critical, and you know, on top of finding out more about the patient, it helps to build a trust between the ordering providers and the radiologist. It builds relationships.
Yes, absolutely. Yep.
I agree. Dr. Thornton, would you mind sharing with the viewers the historic relationship with the radiology group and Bluff?
Absolutely, Chelsea. You know, I think UW Health Radiology is really proud of the fact that we've provided radiology services for the people of Boston, and the surrounding areas of Elroy, Necedah, Lake Delton, and New Lisbon for the past 12 years. You know, this was the first practice location for our group outside of the Madison area. So, you know, it was like our first love, basically, you know. And I think we've learned a lot from this relationship. We go back a long ways, and I think we've used the success that we've had here as a template to find success in other outreach locations like Fort Atkinson and Richland Center. But, you know, getting back to our location here in Bluff Medical Center, we have a radiologist here, as you know, 5 days a week on site. I think that's critical to build those relationships we talked about, Justin. And outside of that, overnight and on weekends, we cover any of the imaging that's done here through the PACS interface from Madison. So again, just a great value that PACS has brought to us. And we're available by phone 24/7 for any consultations or discussions regarding appropriate imaging or more detailed discussion. Now, I think it's important also to talk about the Wisconsin idea. You know, UW Health Radiology, we really try to live the Wisconsin idea. And for us, this means basically using the clinical expertise that we have from UW Hospital and taking this true outreach to the people of Wisconsin and to the providers that look after them. You know, I think that it's really important for people to know that when they come to Miles Bluff Medical Center, that they're getting high quality, state-of-the-art imaging. While they're being imaged at home, I think the experience should be the exact same as they would get in a larger imaging center, but except for the fact that they're being imaged at home and in a much more familiar and comfortable environment.
It's quality care closer to home, for sure.
Exactly.
Right.
We got to take a short break. Dr. Frank Thornton, thank you so much for the information today.
Thank you, Justin.
Yes. We'll be right back with more Wisconsin Doctors coming up right after this. Stay right here. Welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center, and today we're talking about the different types of medical imaging that are available. And I'm joined now by Kelly Honnold, who is the lead CT and mammography tech here at Mile Bluff. Kelly, welcome.
Thank you, Justin.
So, you know, I was just thinking there are so many, when it comes to imaging tests, there's so many different types of abbreviations. There's MRIs and CTs, and I know those are some of the more common ones that are used. What are some differences between like CTs and MRIs?
Well, CT scans use radiation to acquire images, and whereas MRIs do not.
Okay.
CT scans are a lot faster. You can do a basic CT scan in like 5 minutes, and MRIs usually take 30 minutes to 60 minutes to do a study. That being said, CT is less sensitive to patient motion, so that is what is recommended in an emergency room setting, is to do a CT scan. CT is good for looking at bone injuries, kidney stones, lung nodules, chest problems, detecting cancers, and MRI is better for like soft tissue injuries, for ligaments and tendons, spine injuries, sports medicine, brain tumors. The radiologists are well aware of all the tests that are offered for CT and MR, so we do work closely with them, and they know what's best for the patient, and based off of their history and situation.
Sure, and so the radiologists work with both CTs and MRI scans, even though that the MRIs do not use radiation necessarily.
Yes, that is correct.
Very interesting. Very cool.
True, Justin. If I might just interject, we work a lot with the physicians. Sometimes they're not sure which study to order, and so we get a call to the reading room, and we try to discuss the pros and cons of each study based on what they're looking for.
Right.
So it's an important part of that interaction.
Yeah, I had no idea like what a large role you have in so many different facets. That's very, very cool.
Kelly, getting back to CT, we often have the patients drink oral contrast, but we also give them the intravenous contrast. Can you explain to the viewers why we do both?
Yes. Oral contrast is used to enhance the stomach and the gastrointestinal system.
That's that colored juice that you drink, right?
Yes, yes. So that brightens the organs, the GI system, and it shows up bright white on the images, so the radiologist can help detect pathology if a patient has it in their GI system. We do ask patients to stay NPO, meaning nothing to eat or drink, and that helps that contrast to move quickly through their system. The IV contrast is injected into a vein in their arm, and what that does is it helps highlight their blood vessels and tissues, your organs such as your liver, kidney, spleen, and also the brain. Your body does eliminate this contrast pretty quickly, so there are not many side effects from the contrast. It's considered to be safe, mainly in patients who have a normal kidney function. So we do check their kidney functions prior to injecting to make sure that that is safe for the patient.
So the kidneys are primarily responsible for kind of getting rid of that once we don't need it anymore.
Yes.
Got it.
Common side effects of the IV contrast are like a warm flush feeling in a patient. They can feel it in the back of their throat, down into their bladder, funny taste in their mouth. That's all normal. That usually lasts about a minute and then it's gone. If a patient has a documented iodine allergy or the patient tells us they're allergic, we do research that and to make sure it's safe for the patient to have. Sometimes we have to pre-medicate these patients or they may not be able to have it at all, and we do survey the patients prior to any CT scan and injection to make sure that it is safe.
You have the checkpoints in place to make sure that you're not giving it to the wrong people.
Kelly, can I just switch topics a little bit? Because I see you interacting with patients in the hallways every day, and a large part of your role is in breast imaging. And I know that when patients come for breast imaging, there's a lot of anxiety surrounding it. Two of the modalities we use are mammography and ultrasound. Could you explain a little bit to the viewers, why we would use one over the other, or how they are related?
A mammogram is the best exam to look at the breasts. You can see the breast as a whole. It shows the landmarks the best. You can see the pec muscle. You can see the abnormalities in the breast, know exact location of where it's at. If the patient has calcifications in their breast, you can see that with mammography. Ultrasound can determine if an abnormality has a water-like substance, which would make it a cyst, and that usually is of no concern to the patient.
Right.
But if the mass or the abnormality in the breast is solid, then therefore the patient may need a biopsy.
Yes.
And that's one thing mammography alone cannot tell us if it's fluid-filled or solid, so that's why we need to do both.
We got to take a short break here, but Kelly Honnold, thank you so much for the information today. It was nice talking with you.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center here in Mauston, and today we're talking about different types of medical imaging. And I'm joined now by Dr. Liz Teigen, who is the Medical Director of Medical Imaging at Bluff Medical Center. Welcome, Dr. Teigen.
Thanks, Justin. Great to be here.
Yeah, good to have you with us today. So now, in recent years, there has been more attention given to the idea of radiation associated with X-rays. How do you address this issue?
Well, we use diagnostic imaging for our imaging, and it is relatively low-dose radiation. In the vast majority of cases, the benefits of having a procedure done far outweigh the risks.
Sure.
So in general, very low-dose radiation. We also look at the appropriateness of each study before we do it. And if possible, we can use other modalities that don't give ionizing radiation, such as ultrasound or MRI.
Yeah, we talked about some of those earlier, so yeah,
exactly.
Absolutely.
In any event, we try to minimize the radiation dose as much as possible. CT is a perfect example of how we do that. We have a state-of-the-art scanner that Bluff Medical Center is invested in. We have protocols specifically designed by our department at the University of Wisconsin that we've brought here, use that, and then the combination of the two, we've been able to vastly decrease the amount of radiation exposure to the patient. So big improvements with that. In addition, for example, again, the CT, we give a dose report with each and every study. That becomes part of the archive study. And we're able to also look at that and continue to monitor and make sure we're continuing to use the lowest possible radiation dose, but yet giving a high quality exam.
So it sounds like the technology is advanced enough to where you're still able to get the same quality of image or even better with less.
Absolutely.
That's awesome.
And in some cases, tenfold difference.
Sure, that's great.
Dr. Teigen, colon cancer screening is important. Can you tell the viewers about colon cancer screening with virtual colonoscopy?
Sure. That's a service that we offer here and have for some time. Virtual colonoscopy, also called virtual colonography, is an alternative to optical colonoscopy. It uses the CT images combined with computers to generate 2D and 3D images of the colon.
Yeah.
It is less invasive. This is an alternative to the more traditional optical colonoscopy, which involves a flexible tube with a camera and being inserted into the colon. They're nearly equivalent in general exams. One advantage of having VC or virtual colonoscopy is we don't use anesthesia. So the patient doesn't have to be sedated. You can drive yourself to the exam. Following the exam, you can resume normal activity. But again, in deciding what exam is best to you, discuss it with your doctor.
Sure, absolutely. Very important to do.
In regards to virtual colonoscopies or any other tests that we provide in the imaging department, a common question that we often receive from patients is, when can they expect the results? What do you typically tell patients?
Yeah, a good question, and it goes back to the investment in Bluff and getting all this new technology and the PAC system. We'll have the test results same day, and often much quicker than that. Emergency cases and urgent cases, our turnaround time is less than an hour. That's our goal. But we look at that data continuously, and I think Frank may know the number exactly, but I think we're around 20 minutes on an emergency room patient. Very quick, and this is to a finalized report, documented finalized report. So those are different categories. So it depends on if you're just getting a routine EMR or if you're in the emergency and your trauma. If that's the case, very rapid turnaround time. There's another level of resulting called a critical result, and those get our immediate attention, and that's a direct phone call always between the radiologist and the ordering provider. So we have the ability to have very quick turnaround time with our resulting.
Awesome, awesome. That sounds very good. So I want to take the time to thank you, Dr. Teigen, for joining us today and for giving us some great information. It was a pleasure talking with you.
Thank you.
So I also want to thank all my other guests, Chelsea Cook, Dr. Frank Thornton, and Kelly Honold. We've been here at Bluff Medical Center talking about medical imaging. From all of us here at Wisconsin Doctors and CW57, we're inviting you to live longer, live better. We'll see you next time.